Hi, I'm Mo Wolf. I wanted to share with you a simple Qigong exercise. It'll take about 10 to 15 minutes to accomplish. When done daily, it will increase and improve your overall wellness and well-being. It's an exercise that, within the context of Chinese medicine, focuses on the Zang-fu relationships of the organs in the body. In other words, it's focusing on the functional aspect of the lungs, the liver, the heart, the spleen, and the kidney. The beautiful thing about this is this exercise is versatile. It's not just something that can be done for helping to lower high blood pressure. It's something that can be done for folks who have shoulder injuries and want to try to increase that range of motion and mobility of the shoulders. The thing to keep in mind with any time you have a joint injury is you've got injury of ligament and tendon. Ligaments and tendons do not have blood supply going directly to them. These sinews of the body are nourished and expel waste through osmotic movement. That osmotic movement is facilitated by actual body movement. So if you've got a shoulder injury, say you've been getting some treatment from your acupuncturist, chiropractor, or general practitioner, or physical therapist for some shoulder injuries, maybe you had a slight rupture of your subscapularis rotator. Well, instead of having you walking around in a sling all day, your physical therapist gives you bands to work with to try to strengthen these muscles, but they're not just trying to strengthen the muscles, they're trying to move those tendons and ligaments through a range of motion. So that way the macrophages and the neutrophils and everything that God put into your bloodstream to help repair and rebuild your body, all of these things can go into the site of injury and help fix it and clean it up. I'm getting off on a tangent. Let's get back to the Qigong. What does Qigong mean? Qigong means work, energy work. Qi, energy, Gong means work. So this is something that you need to be working at. This is something that you don't just do once. This is something that you incorporate into a lifetime. First things first, we have to review the 4 corrections of Qigong. Correction number 1 is proper position. Remember that string from due 20 down into below the sacrum into the coccyx of the spine. Someone pulling on it, your chin tucking a little bit, your pelvis tilting forward, your spine straightening out, your knees are bent just a little bit, your arms are at your side, and you're breathing. Correction number 2 is proper breathing. Breathing down into your dantian. Correction number 3 is focus, focusing the mind. In this case, I'm going to give you several things to be focusing on while we're doing these exercises, be it that you're an asthmatic, be it that you are a very livery person, as we'd say in Chinese medicine. In other words, you might be very irritable, you might have high blood pressure, you might get vertex headaches. All of these things are a livery person, livery pathology. Say you're having heart problems, irregular heartbeat, palpitations, anxiety. These are things that we're going to be focusing on while we are doing these exercises. Not the pathology per se, but focusing on addressing them. So, proper position. We're going to be doing the ZangFu series of Qigong exercises that were taught to me by a dear friend and mentor, Dr. John Burns. Dr. Burns has been teaching Qigong and Tai Chi for years. He is a master of both, and he has taught me much. He's also one of my professors from medical school, Chinese medical school, and for that, sir, I thank you. Begin with taking proper position. This first exercise is going to be focusing on the lung function. And what I want you to think about, if you're someone who suffers from asthma or shortness of breath, maybe emphysema, COPD, any of these problems where you have shortness of breath, I want you to focus on breathing as deep as you can, filling that whole abdominal cavity with air, getting that diaphragm to extend as low as you possibly can, and really working it and pushing it out. we want to try to create as much internal and external inhalation and exhalation as possible to start using all of the lung capacity that God gave you. So, to begin with, proper position. And as you inhale, you're raising your hands, and this is all on one inhalation. Right up in front of you. Begin to sink as you exhale. Inhale. Exhale. Remember that tip of the tongue is right behind the teeth. Focus on your body position. Focus on your breathing down into the dantian. Focus on getting that air to go into your body. Again, one last time. If you've got a clock like I do on the wall behind me that makes a click for each second, you can help utilize that to time your breath. You should be getting between 6 and 12 seconds per inhalation and between 6 and 12 seconds per exhalation. Now you're not going to be able to do that right off the bat. Remember, this is energy work. This is something you'll have to work up to. You don't want to be moving fast. You want to imagine yourself in a tank of water that's filled right up to your upper lip, and your nose is just above that surface of the water. And as you breathe in, if you move too quickly, you're going to create waves, and you're going to be sucking in water through your nose, and nobody likes that. So you want to move slowly. You want to concentrate on even feeling that water that you're in between your fingertips. Next, we're going to go out on a 45-degree angle. And we're going to be pushing that yang rising energy downward, getting it back down where it needs to be, where it's going to do some good. Focusing on that high blood pressure and pushing it down. Next, you're going to be focusing on the heart. You're going to be coming out on a 90-degree angle. Inhale, start to exhale, the hands come together in front of you. Remember to move slowly because you're in that big old tank of water. Your hands come together in front and push down. Start inhaling. If you've got anxiety, palpitations or anything like that, now is the time to be focusing on taking that anxiety and pulling it from the shin, from the heart, pulling it out and pushing it down and getting rid of it. If you've got palpitations, you're thinking about gathering as much energy as you can strength as you can, packing it in and packing it down. It's a mind game. Basically what you're doing is you're getting your mind to deal with the issues on a physiological basis to help trigger the proper hormones in the brain. Is essentially what's taking place. We'll watch that one from the side. Again, this is for the heart. The next one that you're going to be doing is for the spleen. And what I want you to do is, as you're breathing in, bring one hand up, and as you start to breathe out, bring the other hand up and the first hand down. Great to do when you've got some indigestion, food stagnation, and a Chinese pathology. Because what this is doing is this is actually increasing peristalsis within the GI tract. Think of mixing things up. Next, you're going to take your hands and point them forward, and you're going to move with your dantian from side to side. I'm not moving with my shoulders. I'm not moving with my knees. I'm leading with my dantian right here. Breathing in. Stretch a little bit, and as you're exhaling, turn to the other direction. What you want to try to feel is that water flowing through the hands. Remember, you're in that tank of water. Come back to center. And those are the Zang-fu Qigong exercises.